this morning. Our conversation happening with Dr. Peter Staats is brought to you by Marcus & Mack, a law firm representing injured people. And let's get him on the line here this morning as we talk to Dr. Staats about one of the lingering after effects of COVID-19. He's in Jacksonville, Florida. He's a quite accomplished guy, Chief Medical Officer of the National Spine and Pain Centers. He's a co-founder and Chief Medical Officer of ElectroCore, former president of North American Neuromodulation Society. The guy just has a lot to do in his day, and he took some time out of it to spend with us, and we appreciate that. Dr. Staats, good morning.
Good morning, Todd. Thanks for the nice introduction. I appreciate it.
I'm glad to have you on the air today because it really is true that as we get further along the road here, we're going to find out more and more about lingering after effects of COVID-19 and how this is affecting people in the much longer term. One of those is chronic fatigue, and that is really something that is beginning to become more and more evident, and you're the guy right there to tell us all about it. Tell me what chronic fatigue syndrome is and why, in your mind, it's a part of the COVID-19 formula.
Well, it's interesting. This is an area that's still evolving, still trying to figure out a lot of things out. But one of the problems that we've seen with this long COVID syndrome or long-term COVID is a variety of sets of disorders that are occurring in patients with chronic, who have had COVID and are ostensibly better. 30% of all patients who get COVID are getting one of these kinds of disorders. And, pulmonary problems, migraines, and fatigue is one of the other areas that are really quite common. I believe that the chronic fatigue syndrome is probably a neurologic problem that's caused by persistent inflammation that's occurring following this bad reaction with COVID. That's part of it, but there are also probably, just the obvious, you've been beat up by this disorder, and your body's just recovering. So it's a little bit of each there, but this chronic fatigue syndrome is a real problem. It's a neurologic problem, and it's thought to be in part mediated or caused by persistent inflammation. What your listeners are probably hearing about, these cytokine storms. Mm-hmm. It's probably a spectrum of the same set of problems that have occurred, but it's just persisting and manifesting in this setting and it's just being exhausted.
When it comes from different body parts or areas of the body, whatever that malady happens to be, in this case we're talking chronic fatigue, is it because the virus attacks different parts of your body or a different area of your brain? How does the virus actually work inside your body?
Yeah, that's a really good question. And so I think in particular with this with this long COVID syndrome, there are probably 3 or 4 different causes of problems that go to various organ systems. And just determining which organ system it's going to is really, we don't know why it chooses the gastrointestinal tract for some people and the brain for others and the lungs for others. But the 3 or 4 would be certainly the virus itself can cause scarring and damage to tissue. There was recently a paper that came out that just over 50% of people with long COVID have heart problems, that scarring could occur. A second problem would be chronic inflammation, as I mentioned, this persistent, what's called cytokines or measures of inflammation. I think this is going to turn out to be a big, big problem. A third problem, of course, is the vascular system and your blood system. There are 60 miles of blood vessels in your body, and these are being targeted for some reason. And if you think about it, you don't have enough blood supply to an organ system, things don't work quite as well. And so we have these various sets of problems that are attacking various organ systems, including the nervous system. And then lastly, that we're not quite as clear on is it can damage the nervous tissue directly, and that's what you hear about with loss of taste and smell. Mm-hmm. Good news is it's coming back for a lot of people. Bad news is it's not coming back for everybody. And it's really more than just an annoyance for people. This could be life-changing and life-altering for people.
Well, you said they're problems, and when problems crop up, then the search for solutions begins. And so we want to talk about the search for some of those solutions. Obviously, those can be more than just a little debilitating and maybe even create some whole new branches of medicine. So what are some of the solutions when we're talking about chronic fatigue? What should we be doing beforehand, during, and after we suffer COVID?
Well, I think chronic fatigue's not got quite enough attention yet, but I think we will. And let me tell you about some of the areas that we're starting in that will probably have some overlap down the road. First is, you mentioned that I do a variety of different things. I'm an inventor. I have a medical practice. I'm also a founder of a company that got an emergency use authorization from the FDA back in July. It's one of the only therapeutics out there to help people breathe. Now, if you can't breathe, you can't get better. And this was really designed to improve the decrease in airflow or exacerbation of like an asthma response. If you're gasping and you can't breathe, this little device we can place on the neck and turn off or open up the airways, open up your ability to breathe. And one of the questions that is going to be out there is, can this same device stop the inflammation that we think is associated with chronic fatigue syndrome? So that's where, we have an FDA emergency use authorization, one of very few therapeutics out there. It's approved for breathing, not for for chronic fatigue syndrome. But the similar mechanisms may turn out down the road to be relevant. And that's one of the areas that we need to continue to do research on. Another area that I spend some of my brain power on is trying to help what's called Survivor Corps. And your listeners can go to survivorcorps.com, and this is a nonprofit group that has got 150,000 members who have had COVID and have long COVID symptoms, and trying to help them from a medical perspective come up with strategies for patients, for doctors, and then obviously for patients to help manage their difficult symptoms. So, lots of things coming. One aspect is, we repurposed this device that I developed back many, many years ago for migraines for this airway reactivity problem. But this is, spot-on label for patients with chronic migraines who have gotten much, much worse with this COVID. So it's something to think about as mechanistically we believe this should work, and it's already approved by the FDA for treatment of migraines.
Well, I'm looking at the Survivor Corps website right now, survivorcorps.com, and for folks who want, it's like when you spell Marine Corps, it's C-O-R-P-S, so it's one word, survivorcorps.com, and that's an extensive website, Doctor. You've got a lot of things up on there.
Yeah, well, and I don't take credit for it. I'm just helping Diana Barrett, who is the leader of this group, who's really just working really hard to, A, I think, validate patients' concerns, B, be a resource for patients to turn to, and then what a group of the doctors who are volunteered to help her is to come up with treatment guidelines for all of these different disorders, and that's evolving right now, and we're going to hopefully have some better answers for doctors, but also, of course, for patients. And then, with that comes society as well. So there's a big effort by a lot of people looking at this right now.
So the device you talked about having invented and gotten the approval for, where are we going to learn about that? And tell me about the studies that must, by necessity, go on in order to get it approved for some of the other applications you spoke of.
Perfect. So the people can learn about it from gammacore.com or electrocore.com, and there'll be some interesting information coming out. We started with a grave concern over not having enough ventilators. If you remember back, Governor Cuomo was talking about we're not going to have enough ventilators, and I started a series of studies that are being done in Pennsylvania at Allegheny Health Network with some great doctors there. We've completed the first big study at the Valencia Hospital in Spain with 110 patients randomized to receive either a device or standard of care to see if we can show changes in these inflammation measures in hospitalized patients, as well as help them breathe, of course. And then there's going to be further studies ongoing for the patients who have survived the acute illness and are still suffering. areas of migraine are of interest of mine, and other areas such as that are absolutely going to be necessary for me to say, yeah, this works for this. Right now, what I can tell you is that we have 40 some odd studies in headaches, from basic science work in animal models up at Harvard through cost efficacy studies on migraines and cluster headaches. So the therapy out there approved before COVID likely will be helpful for the patients with the same diagnosis in a COVID setting. So lots of work still needs to be done, but we're getting started.
Doctor,
the last thing I would say, last thing I would say is, as a society, we need to put a lot of effort into this. This is going to be a huge tsunami coming right at us, and 1% or less of all of the studies being done right now are on patients with long COVID. It's time for us as a country, as a society, to up our game and increase the number of studies being done for patients with long COVID.
He is Dr. Peter Staats. We're out of time. Thanks so much for being with us today. Very informative.
Truly my pleasure. Thank you very much, Todd.
Have a great day. It is the voice of Indiana County, WCCS.